Hi, my name is Kelly Charles, and I will be showing you how to do an ECG on a patient, or an EKG. They both mean the same thing. So, for doing this procedure, you'll need the pads for it, and then you also need alcohol pads for this. And so, if I was supposed to do this on a patient, I would walk into the room, I would introduce myself, and then identify the patient, ask like date of birth and different kind of questions. And then I would ask them that I'm going to take their vital signs. So then I would take their blood pressure, their height, their weight, their temperature. And then I would go on to the procedure for the ECG. So I would then wash my hands at the sink, and I would turn the water on, get soap on my hands, and I'd rinse them real good, like the whole way up on the arms too. And then I would do it for, like, if I could sing the alphabet song or the ABC song, or the ABC song and a birthday song. And then I would rinse them off real good, and then get a towel, dry my hands off real good, and then I would turn the water off. I wouldn't want to turn the water off before. So then what I would do for the patient is I would take one of these alcohol wipes, wipe their chest real good. And for this EKG, you would do pericardial leads, and this one is just like the V1, the V6. This was to check your heart and stuff. So for the first, the V1 one, I would stick on the patient. After wiping them with the alcohol wipe, I would stick it on the fourth intercostal space to the right of the sternum. And in the second V2, I would stick on the fourth intercostal space of the left of the sternum. The V3, I would directly between the V2 and the V4. So that would be in the center here. And in the the V4 would be the fifth internal space at the left of the mid-clavicular line. So that would be right here. And then the V5 would be level at the V4 at the left interior axillary line. So that would be right here. And then the V6 would be level with the V5 at the left mid-axillary line. So that would be right here. So you got your V1, your V2, your V3, your V4, your V5, and your V6. So then, being connected to the leads, that would check your VA, V2, V3, V4, V5, V6. You would be connected to a computer. That patient would be. And then, as the medical assistant, I would check on the computer, get the paper, like the computer up with like the paper of the ECG recording, print that paper out so that the doctor could go over it and talk to the patient about what's going on, what have they found, different things about the heart you can check on here. There's many different other things they can do. They can do leads on your arms and legs, and recording the pulse to move up and down the left and right. Different things like that. And then after doing this with the patient, I would then remove these off of the patient. Gently remove them, not rip them off and give them, rip. Don't do that. Gently remove them as slow as possible, but not too slow. Don't want to put the patient in pain, Remove them gently, all 6 of them. Then after removing this, I would then take the other alcohol wipe that I have and wipe the sticky stuff off the patient. And then I would tell the patient that the doctor will be right in to read the records of the ECG. Thank you for watching.